Now we'll talk about another aspect, which is under neurological examination. That's basically physical examination as you are going through the different systems of the body. So the central nervous system, you try to access the cortical and the cerebellar function in patients. Okay. So under each aspect, you look at what you're actually looking at, none of that. So it's actually under neurology in orthopedics, and it often requires evaluating cortical, that's higher brain functions, and cerebellar, that's basically what coordination functions. So starting with the cortical, which is higher brain functions now, so you're trying to reflect on the higher brain activity, how the frontal lobe is working, how the parietal lobe is working, how the temporal lobe is working. You look at it. Okay, see. Okay, so what are the things you look at? You are looking at how conscious the patient is and how oriented the patient is. Levels of alertness, awareness of time, place and person. You're looking at language too, as a dominant hemisphere. So speech fluency, how fluent is the speech? Then comprehension, how they are able to name things, how they are able to repeat things, how they are able to read, how they are able to write. You understand? So basically, you are looking at the Glasgow Coma Scale. Okay, so memory too, how they are able to recall things. Motor movement, how they are able to do all those learned tasks like comb the hair. All those fine activities. Okay, notice, recognition. If they are there with their partner, you can ask them who is this. If they are there with their brother, you ask them who is this. Object recognition by touching. Okay, then recognizing numbers, trees on their skin. So abstract thinking, problem solving and judgment. Tested with proverbs or simple problem solving task. So the other one now just have to do with balancing, gait and balancing. So cerebellum coordinates movements, balance and posture. So the examination here is focusing on dictating ataxia and coordination deficits. So you are looking at the gait and balance. You are observing how they are walking. They are tandem gaits, that's heel to toe, and rhombic stairs, cerebral lesion. None of that. You are looking at that because it will cause unsteady gait. You balance on one foot. Okay, and they move their hand maybe to their nose back, and all of that. So it's a finger to nose test, heel to shin test, and dysmetria. Okay, so this is what we got. So also some rapid alternating movement. There are speech, scanning or slurred speech, nystagmus, and eye movement. You're looking at all of that. Okay, so for these two aspects, this is what you are trying to access.